Welcome back to part 2 of the SIBO Doctor podcast, and let's jump right back into it. That's a really good point. Now, after this, or don't do it every day, okay, do you recommend that, because normally in a regular sauna, you have 3 cycles of 10 minutes each. In between, you take a very cold shower, top to bottom, every nook and cranny, and then you lie down with your feet up, right? And then you go back into the sauna. So that's the Swedish sort of sauna. And
that's great. As long as you're doing the cold, if it's 10 minutes and then you're doing cold, that's great because you're giving the body the chance, all the circulation and the surface of the skin to close, and you get that pumping action and all of that. So, but I wouldn't just like blast yourself for, 30, 45 minutes straight. And, there's always people out there. So don't be one of those people. More is not always more, like you can't, okay, if I can, do this workout in 15 minutes and get, you end up injured that way. It's the same thing with these other kinds of therapies. You need to allow the body to go through its natural processes. And again, depending on your miasmatic influences, the health of your terrain, how sensitive you are.
Yeah, can you explain the miasm?
Miasm is sort of like your inherited tendencies. I mean, I did a whole course when I was teaching for Soroil and using a lot of Unda compounds in combination with single homeopathics about the connection between miasm and epigenetics, because in some ways it's we inherit these settings on our genes, and that's part of the epigenetic science, is how the genes are turned off or on by how we've adapted to our environment. Well, the miasm is just a more primitive way of thinking about that same thing, right? If our forebears were exposed to tuberculosis for 7 generations, you can bet that has done something to what we've inherited in terms of our predispositions towards certain types of diseases. It doesn't mean we have tuberculosis, but if all of our generations prior have had certain types of health challenges, we all know that we inherit these kinds of things. And sometimes it's not in the genes. Genes take how many millions of years to change, right? I mean, evolution is a slow process. Epigenetics changes much faster, and so does the miasm. So as a homeopath who thinks about miasm, there's going to be certain types of therapies and certain types of medicines and remedies. If I know somebody is highly reactive, a Lymphatic person who's highly reactive, I'm not going to blast them the same way, because that might be the kind of person that the toxins get driven into a different part of the body, and then they end up with a much more severe pathological process. But tuberculinics is a good example because they lack internal heat. So a tuberculinic, yes, you need to gently, on a very regular basis, support the natural immune function. So when you have some inflammation, for example, the last thing you want to do is suppress that. You want to support the eliminations, support the inflammation so that the body can heal. We can harness those self-healing capacities instead of just trying to sledgehammer it back into submission. So again, it's a more refined process, but yeah, miasms are fascinating, and they're kind of old-fashioned. But once you have that lens to look through, you can get much better results because you kind of know the tendencies of each type of person. And I think as longtime practitioners, you probably have the same. You may not have a name for your framework, but you can tell within 10, 15 minutes, okay, this is the kind of person I'm probably going to get better results with doing these kinds of things and not doing something else. So, we all have our typologies that we use to understand who is in front of us. So miasm is just one of those things that I look at.
So that's great, because a lot of practitioners, it's interesting because when I came to Australia, they don't have homeopathy as part of their curriculum, really. And so when I went through Bastyr, I absolutely loved homeopathy and took extensive extracurricular courses with Rajan Sankaran and all that kind of
Yeah,
really
yeah,
amazing. So it's not a foreign concept for me, but it is like you say, there is a lot of people that naturally, or practitioners that do have sort of like an intuitive sense of their patient's terrain. And that's really what
of
we're
course.
talking about, is that we're just
Yeah.
giving it an old-fashioned name. And what Hahnemann called the sort of swamp that you're born into. What is the swamp like? You know, is it mossy? Is it dry?
Oh
Is it
man,
wet?
it's
Is
a
it
good time to be in Australia because the swamp here is just getting worse every day.
different
every
kind of swamp?
every kind. Help!
We have our
Yeah,
own swamp. Trust
I'm
me.
sure the swamp
Oh
is
yeah.
worldwide for sure. Anyway, so yeah, no, absolutely. And my teacher, Dr. Guignot, who was my primary homeopathic teacher, who came from the French school of complex homeopathy, would talk about the garbage can, right? So the miasm is a way of understanding how we eliminate. So, very, very briefly, the psoric person is sort of the most healthy person who never gets sick. Then they come down with a virus, they get a super high fever, they eliminate super effectively. They have either, vomiting or diarrhea. They're sick for 2 days. They're back to work. They feel great. The tuberculinic, well, I'll save tuberculinic for last. The psychotic person turns their toxins in and they store them up in the garbage can until the garbage can is so full that they're just overflowing a little bit constantly, like these irritating eliminations. And then the lymphatic person I mentioned earlier has these more sort of like violent and unpredictable reactions. So Dr. Guignot would say they burn a hole in the garbage can. So to get rid of their toxins, they just do something crazy and violent and burn a hole. So ulcers are very lymphatic. People with ulcers or chronic severe pathology that comes and goes very quickly. And then the tuberculinic is sort of the modern miasm, problems with immune issues, and we all know how common autoimmune issues are. The tuberculinic tries to eliminate their toxins by using their immune system, but their immune system is super ineffectual. They have a lot of lymph issues. They have low-grade fevers. These are your people with Epstein-Barr, chronic fatigue, fibromyalgia. So they sort of like burn up their own minerals in an attempt to help their bodies get rid of stuff, but they're not very good at it. So
those are the four. Are those the four miasms?
Those are the four miasms. In the system that I use, teachers teach, some homeopaths teach there's a carcinogenic miasm and a heavy metal. I just have the four. And three were described by Hahnemann. The only modern one in the system that I use is the tuberculinic. And that really came about, in the Romantic time when people got sicker, the world became more swampy. In Hahnemann's times, there wasn't as much,
Well, they had a lot of infectious disease, right? But they...
Yeah. But it was very discreet. It wasn't this constant low-level attack of pesticides and metals and EMFs and all the various,
that's very
stressors
true
on our system.
How do you spell the lymphatic? Because that's a new one. Is that
Luetic? It's sometimes referred to. I use the French Luez, but it's the syphilitic miasm.
Oh, the syphilitic.
People get very touchy. People get very touchy when you start mentioning syphilis
or psychotic.
So, psychotic. Right? Is SC? It's from fig. The word for fig. It's not psychotic. Yeah, I don't even mention that stuff to my patients.
No, I love it. I love it. It's all good. But it just goes to show the elegance that homeopathy really has. It's not this random system. It is actually a very, very recognized system of medicine by the World Health Organization. It is a very sometimes dramatic thing that works, or medicine that works when nothing else works. I've used it on animals. I've used it on babies. Therefore, it's not a placebo.
Yeah, placebo. Yeah. Right. But in like you said, it has to be applied in an intelligent, system-wise manner. you can't, in my opinion, the classical method never made that much sense because you can't expect one single medicine to address this panoply of issues that everybody that we see has, you know?
Maybe not
So,
anymore, but
yeah, not
people are.
anymore. We're too thick.
Yeah. That's a good point. Okay, getting back into, so we've got the physicalities. We've got basically the sauna are an excellent way to stimulate your lymphatics and to help them to detoxify. And just as a basic physiology, as Dr. Nash mentioned, your lymphatics actually sort of are running alongside your vascular system. They're not joined other than when they link up to I think it's
in the capillary beds, right? So
yeah.
they meet in the capillary beds, and that is all happening in this ground matrix, extracellular matrix, interstitium. It's got a lot of different words, which is the connective tissue, And like if you think about it, right? Like I just saw Dr. Mercola actually had a really excellent video on his site recently, and one of the doctors interviewed in that said it's like our whole system, our whole body, our bones, and our musculoskeletal system are floating around in this extracellular matrix and the fascia. So this is really, and this is where the master control system, the nervous system, is also using this electrochemical properties of the fascia to control the whole body. And also another thing, the lymphatics, they're called, penetrate up into the brain.
Yeah, that
so
was
it's
just
essential
recently.
for
Yeah.
brain health too.
Yeah. Amazing stuff.
Yeah.
So, okay.
Until we had the technology to see those, we knew the blood vessels, of course, were going into the brain, but they're so fine, these lymphatics, that we couldn't even see that they're running alongside the circulatory vessels into the brain.
It's a miraculous, we're put together miraculously.
The body is an amazing thing. Yeah, totally.
Okay, so we covered so like I said, the home treatments. We talked about homeopathy, and definitely the take home there for people is, look, if you are a practitioner and you're interested in what we talked about, you might want to look at actually getting trained up a little bit, and maybe you can give us some hints there as to what might be good programs to do for people or put them into.
Yeah.
Mm-hmm. And then, so let's talk about herbal remedies at this point, and what people, like, not to say that people want to self-prescribe, or what are some foods people can eat to stimulate their lymphatics or help cleanse their lymphatics?
I mean, I think more of the herbs, but there are certainly some of the herbal medicines that I use that can be consumed as food as well, like dandelion is wonderful, taraxacum, but people are usually eating the greens, not the root. So herbal remedies are fantastic for lymph moving. I sometimes think of it in terms of different areas of the lymphatic system or systems in the body. For the breast and the upper lymphatics, I use a lot of trifolium and cleavers and dandelion root. Echinacea is also a good lymph mover for the breast. Scrophularia figwort is a really amazing herb to move the lymph. And then, classic things like burdock and berberine, which I'm sure you use a lot of working with SIBO. Yeah. Rhubarb root is fantastic. And then things like Viscum album, sheep sorrel is another one that is really good. So I use a couple of different formulas that are specifically made to move the lymph. But yeah, berberis is something I use quite a bit of, and burdock. Oregon grape is another one. And if you notice, like berberine, Oregon grape, cleavers, these are all anti-infectious herbs as well, antimicrobial herbs. So as you eliminate infections, you're actually freeing up the lymphatic system, right? Because the lymph can slow down and become sluggish from chronic infections as well. So back to the chicken and the egg thing. Your sluggish lymph may make you more prone to infectious issues, but if you have problems with chronic infections, you can also secondarily slow down the lymphatic flow. So a lot of the herbs that move the lymph, and phytolacca for the
Yeah.
breast is one of the best.
Definitely. I was going to say poke root is one of my favorite.
And trifolo. So trifolo and what's one of the other ones?
Is that the Ayurvedic one, the triphala?
Yeah. No, trifala is for the gut.
Yeah.
Trifolo is what's the common name? Red clover.
Trifolium. Yeah.
Trifolium. Yes, is red clover. So that is excellent for breast health as well. And so, and then I also, like you said, I use a lot of the complex homeopathics too. There's a lot of homeopathic medicines. And the ones that I use actually have some of the mesenchyme in them, the ground substance, to help that connective tissue piece as well. So it's,
one of the, I know we could talk for hours. I'm trying to, sort of move it towards wrapping up. But at the same time, I forgot to kind of elaborate on the extracellular matrix, because I personally am totally fascinated with the extracellular matrix. I think it's one of those, like many areas in the body, sort of forgotten areas. And what we're talking about is the fluid outside of the cell that it's sort of bathed in, we're actually mostly made out of water, as you've heard before, probably. Yeah. So those of you listening, so the extracellular matrix is how we actually get nutrients into the cell. We don't actually have a direct channel from a vessel into the cell. It has to diffuse across the extracellular matrix. And what we're talking about here is when that matrix, which is part of the lymphatics to some extent, and some... Yeah,
the lymphatics are little tendrils
that go into the matrix, right? And so somebody actually, I can't remember now who it was, but it was a really brilliant analogy and a good visual for people to kind of imagine if you are sort of toxic with your lymphatics or your extracellular matrix is impaired. It's sort of like the difference between diffusing food dye in a glass of water or diffusing food dye in gelatin. So, it's sort of, if you are really cloggy, nothing can get in or out really well.
Through. Absolutely.
Yeah. So
all these homeostatic mechanisms in the body are compromised. We can't emunct.
We can't emunct properly.
So we have to emunct.
So besides, you have to see the video for that one. Okay. So, but my point to that is that, so before we ever get to the herbs and to all of this other stuff, we need to really address this extracellular matrix, which also responds to basic things like drink enough water, make sure you have enough electrolytes. Your minerals are extremely important, because when you are toxic and gelatin-like extracellular matrix, no amount of burdock or anything will actually, well, I don't know, but yes, you probably would do something. But the point is,
it would make you worse.
Hydrate. Yes, hydrate properly. And if you're somebody that has to pee 10 minutes after drinking a glass of water, you are not having enough minerals in your water. And that's a whole nother issue with adrenal health. But my point is that don't forget the simple things. Drink enough water, hydrate properly before you even get into the sauna.
Move your body.
Those things that you can do yourself. And if you're a practitioner listening, I'm hoping that you educate yourself a little bit more on complex homeopathy, extracellular matrix, how to do the sauna properly, and all those wonderful things. Some final clinical pearls from you, Ginger. This has been so much fun.
Well, I recently started working with a woman. We've been working together for maybe 3 months now. And she was one of those people that is highly sensitive, bounced around to a number of different naturopathic doctors, not to begrudge anybody else's approach, but, I will begrudge the functional medicine approach where it's like, just give 50 different Band-Aids for every part of the body. This is not what we're talking about, what we're doing. So she came in, she had diagnoses of scleroderma, lupus, autoimmune Hashimoto's, typical multiple autoimmune diagnoses, and couldn't and really has had all of the manifestations of the scleroderma. So tons of pain. You can imagine scleroderma is a fantastic problem with the lymphatic system. So the tissues are rigid. They're laying down extra fiber into that extracellular matrix. Talk about, it's not even gelatin. It's getting to the point where it's like leather hide, So how are you going to get anything through? So I said, you've got to become a lymphaholic. We're going to focus on the lymph. We're going to talk about the lymph. You're going to know everything about the lymph and everything that I do. And she's just amazed. I mean, for example, she used to, and she's got kidney disease. So she has to be very careful about everything she takes, right? She couldn't tolerate some very, very basic nutrients. Now we're getting to the point where she can eat a lot more diverse foods, and just focusing on the health of lymphatic. Her pain level has come down dramatically. Her brain fog has improved. I mean, this is something a lot of patients don't even realize they have brain fog until it goes away. And, that can absolutely be part of the lymphatic circulation. So, yeah, so even my point is that even super complex issues like this, it's easy to become intimidated, right? And try to read every study for every potential natural substance that could help these various autoimmune conditions. You just pull way back. You just start simple, start with the basics. I saw Paul Anderson was talking about this in one of his Facebook posts recently, that he's like, he's hammering to all of this is the basics. And I just love seeing that, because even when we have all this really highly specialized knowledge, which we do, and we can manage those really difficult cases, but you have to start with these comprehensive systems in the body where you're going to get a whole body effect. And the extracellular matrix and the lymphatics and the nervous system are all, triplets that have to be part of the initial approach, in my opinion. So
very well said. I think that systems approach is definitely a much more, I think, deeper approach, and also definitely getting more to treating the cause rather than just supplementing with X amount of products. This has been an absolute pleasure. Tell us where people can find you, and if there's patients listening that resonate a lot with what you're saying, or would like to have a different type of approach that uses this complex homeopathy, where can they find you?
Well, you can just Google me. My website will pop right up, gingernash.com. For those listening that are more interested in the hormones and the women's health balancing, I have a great active Facebook group called Feminology, and you can find me on Facebook if you're a Facebook person, or our website is supposed to be launching in the next month, which is feminology.org. But I also want to say to the practitioners out there, because I feel like, Nirala, we've had a pretty high-level conversation, that I also do some training for practitioners, and I'm actually working up a new course load for that. And, very, very hands-on, very practical. They're limited to small classes. So, just Google me, email me. I have a practitioner email list. I'm happy to put you on there. My email is just Dr. Ginger Nash @gmail.com or office@gingernash.com. So I'm easy to find. Sadly, I check my email like 50 times a day. So
Don't we all? I got like too many email addresses. But all of that information will be in the show notes. I'm very excited to hear that you have some training courses for this very, very important work for practitioners that are out there. So that's really great to hear. Thank you so much, Dr. Nash. It's been an absolute pleasure. And for practitioners, please go to the show notes if you'd like more information on where to find Dr. Nash. And also don't forget to please give us a good, excellent 5-star review on iTunes if you're listening, and find this information helpful for your practice. Until next time, we'll see you soon. And thanks again, Ginger.
Thank you for having me, Nirala. It's been a pleasure.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Thanks to our sponsors, SIBOtest.com, a breath testing service with easy online ordering, and Quintron, maker of outstanding breath testing equipment. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.